Good afternoon, everyone. Thank you so much for joining us for today's community chat. I'm Becks Heyhoe, the Executive Director of United to End Homelessness with Orange County United Way. And a couple of months ago, we did a community chat called Ask the Executives, where the attendees got to provide the questions and got to vote on which questions we should answer during the chat. And it was received so well that we are hosting another one of those sessions today. So in advance to today's community chat, you should have had an email with a link to a poll where you can vote on all of the questions that were submitted. We're also going to pop the link to that poll in the chat box, or if you're joining us on Facebook, you'll see it appearing there in the comments. So would love for you to take a moment. If you haven't already voted on today's chat, please click on that link and cast your vote for which questions you want our experts to answer today. So while you're responding to the poll, I would love to introduce our experts today. So we are joined by David Gillanders, the Executive Director of Pathways of Hope, and LaVal Brewer, President and CEO of South County Outreach. Thank you so much for joining us. Before I pull up the poll results, David, do you want to take a moment to introduce yourself?
Well, I think you did a great job, Becks. David Gillanders, Executive Director of Pathways of Hope. We service mostly North Orange County, both singles and family homelessness.
Wonderful, thank you. And LaVal?
Yes, thank you very much. LaVal Brewer, President and CEO of South County Outreach, a hunger and homeless prevention program in South County.
Fantastic, thank you. I'm thrilled to be joined by two wonderful colleagues who are busy at work addressing homelessness here in Orange County. So I'm hoping that you've all had a chance to fill out that poll, the survey. And so I believe that we're going to be able to pull those results up right now. And so we can have a look and see what our questions are for today. So I'm taking a quick look. Oh, their numbers are changing right in front of my face. Okay, I am going to pull out what looks to be, oh no, it's shifted again. Well, this is fun. Do we have anything that's higher than 50%? I'm going to pick that one to get us started. What are the biggest hurdles that Orange County faces when it comes to homelessness? So the biggest hurdles that are being faced in our community when it comes to addressing homelessness. LaVal, I see that you unmuted, so I'm taking that as a sign that you want to take a crack at this question first.
I'll give a start. I know that David will have a better answer than I do, but when I think about it, in the words that we've been talking about, obviously it is having enough housing for people to move into, like having enough stable housing for people to live in. There are also other issues that are barriers in that. It's politics, it's biases, it's the understanding of how to provide wraparound services. So there are a lot of things for us to consider. Dave, what do you think?
Thanks, LaVal. I don't know if my answer will be any better. I think there's two major things. So, or there's a few major things, but I think two of them I'll focus in on. So number one, LaVal said something about politics. And I think locally, one of the complications we have with addressing homelessness is that we essentially have 34 different municipalities that all operate independently under kind of a single umbrella with the county, right? And so I think, to the county's credit, I think county, especially the social healthcare agency and those folks, work really hard to try to align all of those pieces, but ultimately they don't have any power there. And a big problem is that when one city will do something and another city won't, and cities don't work together on projects, one of the big complications there is that folks who are unhoused do not care about city borders. They're going to go where they can get help. They're going to go where they can find a safe place to stay overnight. They're going to go to find people that can help them meet their material needs. And so I think city boundaries, quite honestly, are a huge complication for us that maybe we don't talk enough about. The other one is, I'm going to let the county off the hook a little bit, but the other one is, to be quite honest, is that the work of solving homelessness is really It's really hard to say any singular localized municipality, city, county, and even state is going to single-handedly solve homelessness in their territory. Really, what we need is more and better federal policy and guidance around homes being guaranteed to people, or some sort of system that allows people to know that when they are on the precipice of falling into homelessness, there's a safety net for them to keep that from happening. So, a couple things that I think are really the big picture roadblocks. Some of it's we have some control over, but a lot of it we don't.
Awesome. Thank you so much to both of you for that. It looks like we might be having some technical difficulties with the poll, so bear with me for one moment while I'm just going to have to randomly pick a question here. So I suspect that this one was probably pretty popular. How does the coordinated entry system work in Orange County?
I can take that one first, since, if that's okay. LaVal and I can trade first blows. Coordinated entry system essentially works like this. If you are a person experiencing homelessness, a person who is currently is precariously housed even, there are access points you can go to throughout the county that help both singles and families and all of the other sort of subcategories of homeless folks that can do an assessment for you. And when they've assessed you and kind of figured out what your situation is, they can kind of queue you up for a housing intervention that could come forward. Now, on the family side, I know I can speak more about that because Pathways of Hope actually operates an access point up in Fullerton. You know, if you come to us and we know you're unhoused and you're a family and you're living in a car, we can queue you up for a shelter availability, which is really great. And then that will hopefully start the process within coordinated entry to get you to a permanent housing intervention. So either a housing choice voucher, an emergency housing voucher, rapid rehousing, something like that. It works very similar on the single side, but it's about having the ability to connect with someone who can do that assessment and get you started in a queue that will then hopefully your name will rise to the top at some point quickly, and you'll be able to get that permanent housing intervention.
The only thing I'd have to add on this is it works. that it actually does work. And not having a coordinated entry system, ability for all the providers and everyone to work together, created chaos in the past. So does it work? It does work. Is it perfect? It is not perfect. Will it be perfect? It will, while we continue to work together to solve people's housing needs.
Thank you. So building off that, another question that came in, 30% of our pollers was, is there a central point of contact that somebody can call when they meet someone who's experiencing homelessness? So the coordinated entry system that we're talking about, how do people get into that? How do they get access to it?
You know, like David said, within that question, it often becomes, does the person who's experiencing homelessness or the unhoused person have access to 211 or some other system? Yes, that is available to them. Us as individuals, to call for someone because we have a phone and we feel compassionate about that is important. But it is really critically important for the person who is unhoused and who is experiencing an episode of homelessness to be involved in this effort. So as quickly as possible to get them engaged so they can be engaged in the 211 system and also get to the access point is the beginning and the starting point.
I'm going to throw in a follow-up question there. Could you describe a little bit more about an access point? And do we have access points for just families? Are there access points, say, for individuals or veterans or young adults in our community?
Sure. Yeah, I'll take that. Well, there's something for everybody. So there's access points that can serve everybody. And one of the really great things I think that's developed in Orange County over the last few years is really an informal way of also cooperating, right? So if someone walks into your access point who maybe doesn't fit services that you have or the kind of access point you are, it's very easy to get coordinated with another organization that does do that work, right? You know, in the case of Pathways of Hope, we were very in on the family side of things for access point very early on. And then slowly kind of gradually evolved into a place that could help singles more efficiently and effectively too. And if we can't do something formally for singles, we know exactly who to call that can take care of it. But our tools have evolved, and it's not just us. Other organizations have had that same success, really kind of evolving their abilities to do this work better. There's been a little bit more resources in some areas that have allowed us to do that. It's kind of a, things are formalized and they're well articulated and people understand how they work internally. But I think sometimes to the masses, it's harder to explain. But the coordination, as LaVal said earlier, does work. And the alternative is chaos, and chaos was not a great alternative before.
So like Dave said, there are three areas to look at. There's the family coordinated entry system, the family access points, there's the individual access points, and then there's also TAG, transitionally aged youth, which Orangewood provides in Santa Ana.
Awesome. Thank you so much. Okay, moving on to our next highest question. How do you help someone that doesn't want services and housing?
I'll take this one first. I think, well, here's what I would say. I would say the vast majority of the time, what we offer folks who are unhoused and living on the street does not appear to them to be actually a solution to their problems. And so what I mean by that is, I have never met a person who's unhoused turn down a serious opportunity to have their own apartment to live in if they thought they could afford it and keep it and everything else. I have seen people be reluctant or hesitant or say, I don't know if I can do that, but I've never seen someone just outright go, no, I don't want that. I want to continue to be homeless. I think what the public misconception is on some of this and and I understand it. I understand where it comes from and how we got to this place. But I think there's an idea that people are quote unquote service resistant, when the truth is we very rarely offer the services that actually solve a person's problem. And that's really what the problem is. And when I say rarely, it's not on a rare case by case basis, because as myself or LaVal or any great service provider can tell you, every day we end homelessness for people that walk through our doors. But the problem is there's a lot of people and our doors aren't big enough and we don't have enough services to take care of everybody. And so in that context, sometimes the service that someone needs doesn't exist. So people are immediately skeptical. And honestly, I don't blame them. I don't blame someone at all for being skeptical of something I'm offering to someone. The other thing to consider is where it comes from, right? So when it comes from a trusted entity, a service provider, someone who's built rapport, an outreach group, we have, different outreach groups like CityNet throughout the county and other groups who do great outreach work. When you develop rapport with someone, it's a lot easier to make a case that, hey, I really have this service. It's not a mirage, because honestly, folks who are unhoused are human beings. And when they've been fooled over and over and over again, or sold some idea that they're going to not be homeless because they went and did XYZ thing and then it doesn't work out, I think they have every right to be skeptical. So I don't believe in service resistance. I believe we don't offer the right kinds or enough of the right kinds of services to make the kind of dent we're all looking for.
To add on to that and give us a little bit of color. If an individual or a family is unhoused in city X, but yet the resources for being housed are 20, 30 minutes away, 10, 15 miles away from where they are right now, the reality is, even though you're unhoused, you're probably still participating in the world, right? You're still people and humans. So your children are still going to a school. You may have relatives or family members that support you that are close by. You may have a job right where you are. And to move 10, 15 minutes, 20 miles away may be something that you just can't give up, because the ability for you to earn income would then go away. So when we hear people say, well, I heard someone get offered something and they just turned us down. Well, like Dave said, you may not know the whole situation of that family, that individual, and they get a chance to make decisions on where they live. They get the ability to be self-determined for themselves. Do we want to help them? Absolutely. But we can't take away people's rights and responsibilities and their ability to live where they want to live. If they want to live where they are right now and there's no home available for them right this minute, maybe they'll have to wait until that happens.
Thank you so much. And we popped into the chat box a link Our community chat last month was actually looking at this exact question, and we were able to dive into it in a lot more detail. David and LaVal, those were great answers, but for anybody watching that wants kind of an even deeper dive into it, you can check out that chat on our YouTube and on our Facebook, and we're actually going to be doing a part 2 of that next month. So I'd encourage you, RSVP for that. We're going to keep that conversation going because, as you just heard from these guys, there's a lot to unpack behind this notion of service resistance. And so a lot more and a lot of education that needs to be done around that. And so we are digging into that together. So I'd encourage you, go back, watch the previous chat, join us again next month as we get even further into that. All right, next question in our rapid fire. How do you see homeless services expanding or improving over the next couple of years?
I can start. One of the things that we want to see, at least I want to see, is more organizations continue to work together more deeply. So as we partner with each other to provide services in a network of services, we begin to create a network that really can catch more people. So nonprofits have to, governments have to, and Dave talked about this earlier about politics, we have to continue to think about how do we partner with each other to solve someone's housing needs. It cannot be done by one service provider alone. It cannot be done by one city alone. And it cannot be done in the county by ourselves. We have to do things together. So that's one of the ways that I'd like to see, or I hope to see us continue to move this direction. We are already moving this direction. Can we continue to close those gaps between the service providers and the government? Yes, absolutely, but it's going to take political will.
Yeah, I mean, the only thing I might add is I'm always reticent to get into this conversation about how do we expand, right? Because I don't think we should exist, right? Like, I think we should be taking care of people to the point where we don't have jobs, right? And that'd be fine. I'll go do something else. But, I think I think sadly, in the place of, I guess, the communal will amongst, our society to not have homelessness be something that exists, we're required to do this as a result. And I know people will talk about, the nonprofit industrial complex and these massive organizations that do this and the accountability and all these things. And I hear all these things and, argue on Twitter about it all day with people sometimes, but not when I'm working on my free time. I think the truth is we kind of have to keep doing this work. And so when I see more resources coming into the system, my only hope is exactly what LaVal said. My only hope is that people are effective, efficient, and work more closely together so that we just keep the client front of mind. Because ultimately, when you talk about more money coming into the system and more resources and expansion and stuff, it's a double-edged sword, because suddenly you have all these other stakeholders, right? So you have all these other people you're accountable to, and that's fine. I have no problem with that. But ultimately, the person we're all most accountable is the person walking through the door seeking services. The client is the ultimate stakeholder. They have the most in this than anybody else, right? And so, making sure we stay true to that, I think, as more money comes into the system and as we grow and expand and do those things, I think will be the ultimate test for a lot of organizations.
Thank you. Okay, we're going to change direction just a little bit. So this question was around rehabs in our community. So is it true that people are brought here to Orange County from other states to go to rehab, and after they've had treatment for a few months that they are left to their own devices? Is this why we have more homeless people here?
That is not why we have more homeless people here. That would mean that every city and around us is sending people to rehabs that don't have enough space in the first place. And then these loving, caring organizations who are trying to get people back on their feet just say, okay, we're done, and pop them on the streets. That's not the answer. That's not what it is.
In almost 15 years of doing this work, I've never come across someone that's told me they got shipped out of state to go do rehab. That's just, the reality is we have all the data and statistics we need. We know 70% of the people in Orange County have been here for 10 years or longer, which essentially makes them residents of Orange County. This is repeated in jurisdiction after jurisdiction after jurisdiction. People do not get bused to other places. People do not go where it's warmer. People, if you become unhoused today, you're probably, excuse me, sorry for the alerts coming up on my computer. If someone goes unhoused today, they are probably going to stay where they are unhoused because they have some kind of network there. They know what's down the road. They know how to get to the DMV or the courthouse, or how to get to where the 7-Eleven is, where the guy knows your name, right? Like, that's their network. That's their community. People go homeless in their community and they tend to stay in their community. I was talking about some of this with someone the other day who, I said, this is not the Dust Bowl, right? There's not people with sticks with little handkerchiefs getting on trains and headed west. Like, this is not the way it works. It's not a Steinbeck novel. People get homeless and they stay pretty much where they went homeless. And I think that, that's important. I think that's important for people to understand, because that means these people who are unhoused, they are your neighbors now, and they were your neighbors before. And I think we have an obligation to each other to take care of our community. And those people are your community.
I just want to add on a little bit, because I'll be honest, this kind of frustrates me. When you think about the cost of rehab, so someone is going to take someone, they're going to pay a pretty significant cost for rehab, send them somehow to another state for that cost, for them to then become homeless. Like, it just doesn't, the math doesn't even add up. It's not even a possibility. It's similar to saying that people travel to Southern California because this is where they're going to get extra resources. Well, if you're homeless and you don't have any money, in some cases, how do you travel here? Like, what mechanism do you have to get here? Is it walking across the Rockies? Is it, do you jump on, do you get into the hull of a plane and smuggle your way into this area? How does it happen? So I think we have to have some common sense around what is really occurring. And like Dave said, let's believe the fact that my neighbor, my friend, suddenly cannot be housed any longer in the house they're in, and there's no place for them to go. Let's just believe that.
I think one of the most crazy things is when I take stakeholders of Pathways out to lunch or something, or coffee, and we talk, and they're asking me these kinds of questions too, which is totally understandable. But they say, I say to them, yeah, it costs almost $3,000 a month right now to rent a decent, good two-bedroom apartment in any given city. And they look at me like I'm crazy. And I go, well, maybe it's, because you're where you're at in your life, you haven't heard these numbers in a long time, but that's the reality, which means, at those kinds of numbers, any working poor person, a person who makes your lattes at Starbucks, a person who, works at Target, a person who you interact with, the person who works at your vet, right? Anybody who doesn't make enough money to pay those kinds of rents can go homeless. And that's right here. That's not somewhere else. That's here. Those are your people, my people.
I'm sorry to go on with this, Becks, and I hope you don't mind. I was reading a statistic just the other day, and the statistic said that 70 to 80% of women who who are homeless have experienced some sort of domestic violence. So, okay. What we're saying here is suddenly someone has to get out of the situation they're in, and they don't have a place to go. Now, that is potentially your neighbor. That is the person who lives on your street, because we know that domestic violence doesn't have a single point of stop. It happens in all households, not all households. It could happen in almost any household. So we just have to think deeper and differently about how people get into an unhoused situation.
And we do have, I'm going to ask our team to see if they can go into our archives to pull up a community chat specifically about domestic violence and resources available in Orange County. So once they've got that, they'll pop that in there. And I think the one thing that I want to pull out from those responses is that unfortunately, oftentimes when people think about homelessness, they connect homelessness with addiction. And that actually we need to separate these two things because they do not necessarily correlate and overlap. Sometimes they do, but most of the time they don't. And addiction is not in the top 3 to 5 reasons why people become homeless. And so I think that was a really important distinction that I heard there, is that yes, there are a lot of rehabs and sober livings in our community, But that is not, we can't equate the people who are accessing those services and resources with homelessness. And we need to remember to keep those two things separate. So
another point, go ahead, Becks. Another point of common sense there is, I know of many people who have addiction and are not homeless, are not about to become homeless, are doing just fine in the place they're living. So to say that that's the reason, or I know plenty of people who have mental illness who are not homeless, who do not end up being homeless. So these labels that we're placing on people, trying to explain their unhoused situation, are not actually very helpful. They're unhoused. How they got unhoused is how they got unhoused.
I teach at Cal State Fullerton on homelessness and program evaluation. One of the ways I start class off with when I talk about evaluating our work and effectiveness in homelessness is I say, tell me the difference between a person who is in rehab and an addict who has a house and an addict who doesn't have a house. And everyone kind of looks at me and I say, it's the house. The house is the difference, right? One of those people is housed and the other one is not, but somehow they're both still addicts, right? And yeah, I think, or the difference is money. You can call it resources, whatever you want, right? But I mean, that's why we know homelessness is so driven by economics.
We have got, thank you for that. And if anybody wants kind of more research on that, I would encourage you to have a look at the UCI cost study. It's got some great data around why people fell into homelessness here in our community in Orange County. And then of course, the point and time count data, and both of those are available on the United to End Homelessness website. So we've got time. I'm going to squeeze in one last question because this also came in as one of the top ones. And this is a very specific one, so I think we'll be able to run through it quickly. It seems like Huntington Beach has a significantly larger homeless population. What are the reasons why?
Larger than what? Larger than Long Beach? Larger than Fullerton?
Yeah, I mean, what's the comparable?
Is it because the person who put in the chat, now nothing against you, but is it because you see more people? I don't really know. I can't really answer that. I don't really have Huntington Beach's specific homeless numbers, but does it really matter if it's Huntington Beach? I mean, Huntington Beach is right next to Fountain Valley. If they cross the street, are they Fountain Valley homeless family or Fountain Valley homeless individual?
Well, I would just say that I don't know the answer to this, but I do know that the epicenter traditionally of homelessness in Orange County for 20 years, 30, 25 years was Santa Ana, right? Which doesn't share a lot of characteristics, except they're both in Southern California and the cost of housing everywhere is too expensive and et cetera, et cetera. So I don't know why Huntington Beach has more homeless or why the person who asked is seeing more in Huntington Beach. I mean, I think we're seeing more everywhere. I grew up in Brea, right? And so Brea now is a more affluent town than it used to be, for sure. When I grew up there, it was a little bit more working class, for sure. It's changed a lot, which doubly shocked me, but also didn't at the same time. When I went up to visit my dad not too long ago, I don't go up there very much anymore. And I saw between the 57 freeway and Glenbrook, where he lives, which is half a mile, maybe at the most, saw 3 homeless people, saw 3 unhoused people. And to me, that's kind of shocking, right, for Brea. But again, it's emblematic of the fact that pick a city, there's more everywhere. And it's a real problem.
Okay, so thank you for that. And I think I would just say that I remember there was a while where we worked with a consultant who worked across the entire country. And I remember distinctly somebody asked him the question, why do you think there are more homeless people in Orange County, California than everywhere else? And he just kind of laughed and was like, everywhere I go in the country, they think they have more homeless people than everybody else. And so it's this really it's another one of those myths that every community thinks people are sending people to experience homelessness in New York. They're shipping them out to Texas. They're putting them on planes to Hawaii. And so I think that's where we have to return to data. And that's where we have to look at actual sources of information rather than what we are thinking might be going on and jumping to conclusions and making assumptions. And a number of cities in Orange County have actually done their own kind of census count. And so I would encourage you, if you are local in our community and you're curious around the numbers, and what may have been going on in your city, reach out to your city hall. Find out if they've invested in doing counts in their community. Find out if that's something that they're tracking. And if it's not something that they're tracking and you live there and you think they should, then I would encourage you to come to one of our advocacy classes to learn about how you might be able to advocate to get your city to be starting to pay attention to that. That's a whole other subject, and we are at 12:30, so I have to wrap us up. But thank you so much to everybody who sent in questions. Thank you to everybody who then voted on those questions so that we could have our chat today. David, LaVal, thank you so much for your passionate responses to the questions that we had. If you're joining us on Zoom, there will be a quick survey that's going to pop up so that we can get your feedback. We always want to know how we can improve our community chats. And we will be back next month, as I mentioned earlier, for our follow-up chat on service resistance. And so that you can join us in May for part 2 of that. And again, thank you, everybody. Have a wonderful rest of your day.